from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
All right, we are back with our sponsor, Baptist Health, and in this month's Keep On Amazing, Baptist Health Breast Center Medical Director, Dr. Amanda Ferrell, is here along with patient Kathy Garrett to talk about how 3D mammograms can now detect breast cancer and maybe some that would not have been detected earlier. Welcome to both of you ladies.
Thank you.
Let's start with you, doctor, and just a little bit about mammograms. There's still a lot of confusion out there, a lot of information that may not be correct.
Right. Well, you know, since 2009, when the United States Preventative Services Task Force recommended changing screening from 50 to 74 every other year, patients have been confused, but the science all says you benefit from beginning screening at age 40 and coming every year. That's what the science says. All the studies say we decrease mortality from breast cancer. And in fact, since we've been doing good film screen mammography and digital mammography since the mid to late 90s. We started before that, but the technique wasn't so good.
Yeah.
It matured over time, like everything does. The death rate from breast cancer has decreased by 40%.
Oh, wow. Saving lives right there with the new technology. We're going to talk about 3D imaging coming up, but Kathy, tell us a little bit about your story. You shared a little bit already with me, but tell everybody about finding, first of all, some lumps early on.
I did. Back in my early 20s, I had done, through a self-exam, I had found a knot, and I asked my doctor and had my first mammogram then, and I actually had 3 cysts removed, and they were benign. So I was faithful to have a mammogram every year. I did not miss. And in April of this year, I went to the breast center for my yearly and was actually after the 3D, I asked for the 3D because I had family members that was just diagnosed with breast cancer and had double mastectomies in December and January, and I felt the need to ask for the 3D. And I got the call the next morning that I need to come back for an ultrasound, and then I came back for a biopsy, which did give the diagnosis of invasive ductal carcinoma.
Oh my goodness, thank goodness you were so proactive on your health. Let's back up and talk about the 3D imaging. What is that compared to what we used to have?
So it's basically, you get positioned the same way. We take the same images, the same basic images, but then we do what we call a tomosynthesis sweep, where the camera actually moves and you're taking 1 millimeter thin images through the whole breast. And what you get, instead of having things hidden by normal dense breast tissue, you're able to see through the breast tissue better, and it increases your cancer detection rate by about 20 to 30%, depending on who you read. And it also decreases the likelihood that you're going to get called back for normal breast tissue that's overlapping. Is that a real thing, or is that just some normal breast tissue? So it'll decrease the callback rate by about 20 to 40%, depending on who you read.
Viewers are seeing the 2D right now. We're going to compare that to 3D for doctors. That can just give you such a clear view, right?
So when you look at that image, you really don't see a whole lot. On the outside of the breast, there's a little white line. That's a scar marker placed over where she had a previous biopsy, probably the one from her 20s. And then when they showed the 3D image, it's actually already annotated because excuse me, it's from our system, and so they put a circle around where the cancer is. They're telling the technologist where to look with ultrasound. There it is right there. And these monitors aren't high enough resolution to really be able to see, because we use 6 megapixel monitors. They're incredibly high resolution.
We don't have those at Channel 7. But we're so glad that you do. All right, so tell us a little bit about how you're feeling now and your recovery from surgery.
I'm feeling wonderful, wonderful. I'm going through the reconstruction process now. And I mean, don't be afraid of the pain because it was very minimum, and I feel great.
So great. That's wonderful. I'm just so impressed that you went and asked for it. Is that what women need to do?
So we find that the people who benefit most from 3D mammography are people who have dense breast tissue, and Kathy does have dense breast tissue, because they're the people that the dense breast tissue is white stuff on a mammogram. Well, bad things are white too on a mammogram. So the more white you have, the trickier it is to find a cancer. I'm a total snowstorm, so I got 3D mammography this year too. So it just helps us see through the breast tissue better and make sure that we're actually not being fooled by something that's lurking in there.
So anyone who has questions, maybe has had benign lumps or family history like she has, should they ask for this?
Yeah, they can always ask. And then if they have fatty breast tissue, they may not benefit as much, but I think the standard of care is evolving. So that ultimately, everybody's going to get 3D mammography as the technology matures.
And men too. Men have breast cancer as well. It's a smaller percentage.
It's rare, but we see it.
Yeah,
so
absolutely.
if they feel a lump, they need to come on in.
Kathy, thank you so much for telling your story. You look beautiful and healthy, and we appreciate it. I know she's a great example of what you want all women to do and be proactive in their health. Thank you, doctor. Appreciate it. Remember, Baptist Health, that's where I go for mine, Baptist Health Breast Center. I said they get you in and out quickly, too. I love that.
Yes, we try hard.
And, of course, part of Baptist Health, and we appreciate all of our amazing stories. Keep on amazing stories with them. 1-888-BAPTIST is the number if you need help.